Well, good morning. It looks like this is the week when summer finally arrived. It appears to be a nice day coming up today and possibly for most of the week, although there may be an occasional sprinkle. Hope you have a chance to get out and really enjoy it. Our show today is not about the weather, but about dealing with some aches and pains that may affect our ability to get out and enjoy the weather, whatever it might be. So it all starts right now.
From TV6, this is The Ryan Report. Now, here's your host, Don Ryan.
Well, medicine has come a long way in helping people deal with those aches and pains that can really affect our ability to enjoy life. This morning, we're going to talk about that with Dr. Wallace Pearson, a physician and surgeon with the Advanced Center for Orthopedics in Marquette. Dr. Pearson, welcome to the Ryan Report.
Thank you. It's nice to be here.
And I think you prefer Wally, right?
I do prefer Wally, unless I'm in trouble.
Okay, you're actually a Marquette native, aren't you?
Originally, yes. Originally from Marquette.
And your dad was a doctor, and I believe came to Marquette as an Air Force captain at K.I. Sawyer.
Back in the day, they required a 1 or 2 year military obligation that landed him, so to speak, at K.I. Sawyer. He had plans to go out to Boston to start a practice there, and I believe it was a snowstorm that captivated he and my mother here, and
Really?
the rest is OBGYN and then orthopedic history.
Interesting how those things happen. And I think you may have had some grandparents that were doctors as well, weren't they?
My grandfather, Pearson, also was a physician who was an osteopath, actually, in fact, chairman of the American Osteopathic Society. Both he and my grandmother were both physicians, and he went on from medicine into politics, and he has a very colorful career.
So was it always part of your career plan to become a doctor?
Well, yes and no. I certainly had an awareness of it. I had a, not a jaded view, a privileged view to witness my father starting an obstetric practice by himself in the Upper Peninsula. Anybody that knows anything about delivering babies realizes that that was a full-time commitment. So
yeah.
I saw not only the challenges of delivering healthcare, but certainly the benefits. Witnessing him interacting with his patients in the community certainly let me know the really positive, beneficial, empowering aspects of healthcare. It's really a privilege.
And all of your degree work from bachelor to medical degree was at the University of Michigan?
Well, I spent 1 year, my freshman year at Montana State to go alpine ski race, and then realized I probably had bigger aspirations than fluffy powder. So transferred at that point to the University of Michigan and was there for essentially 10 years. And had the opportunity to do my residency there as well, but felt 10 years in Ann Arbor was probably long enough and spread my wings to upstate New York thereafter.
So you came here in about 1995 to start your practice, was that?
I was done with my training in 95 and started with, at that point, Marquette Orthopedics, and then we transitioned the name into Advanced Center for Orthopedics. So yes, I've been with that group for 21 years.
In those early days, were the orthopedic surgeons as specialized as they are today?
Well, it's interesting. I think that may lead to a discussion here forward about our group. But yes, when I arrived in the group, it was essentially 6 orthopods practicing as islands within an ocean of orthopedics. So we were all doing everything. And that's the way it was back then. And as you know, the person that does one thing repetitively is usually the most informed and the most talented at that. So we were actually quite proactive in our group in identifying that that's where orthopedics would likely be going. And this was 5 or 6 years ago, and realized that for us to evolve positively and proactively, we invested a fair amount of money in recruiting some specialized partners. And we've been very fortunate in how we've achieved that, the quality that we've acquired, and the resultant subspecialized group. Now I say we, I'll throw that net of we into the Marquette community, because truthfully we landed several of those orthopedic surgeons from the East Coast, from the West Coast, not necessarily for our orthopedic qualities, which that was impressive for them as well, but what Marquette represented, both in terms of recreation, a community to raise families, national journals such as Outside Magazine, and I think there's an economic article written about Marquette in terms of a very good place to raise a family as well as practice your business. So it was Marquette community that ultimately attracted our subspecialized partners.
Okay. We'll get back to that in just a couple of minutes. A couple of other memories, let's say, of the changing in your field. What have been some of the key changes? I would think the options you have now with imaging and diagnosing?
Boy, the art of practicing medicine is lifelong learning, and that's truly one thing I thoroughly enjoy about my job, is that what I'm doing currently has been learned well subsequent to my training, and even subsequent to the past 10 years. I'm just doing joint replacements essentially at this point, total knee replacements, and I think to stay contemporary with that operation requires doing just that operation, and to stay in front of the curve and remain not competitive but relevant and progressive and providing good quality. That's my focus, and that's what I have to expend all my mental and professional energies on doing. So yes, I went from, in 1995, essentially doing a lot of orthopedics except for spine and hand. I didn't do any of those ever, to now just doing knee replacements.
Okay. And what about the replacement parts, prosthetics? Have they improved over the years?
Well, you originally asked about technology, and it just has dramatically impacted how one practices orthopedics. From radiology, where if a child came in with an infected hip, I would have to be the one to sedate that child and take fluid out of that hip joint and then ultimately operate on that child. Now it's all done in the radiology suite with just a little percutaneous little poke in the skin under imaging, and it's done much more quickly and more efficiently and more professionally. So yes, imaging has come a long way, but orthopedically the implants that we utilize, how we apply them, the imaging of the implants has really developed.
We'll follow up on that in just a couple of minutes. Back with more on the Ryan Report after we take this break. Our guest this morning is Dr. Wally Pearson. Your specialty is the knee. Let's talk about that a little bit. What kind of things go wrong with the knee?
Well, it depends on the age, really, and sometimes not the age. But early on, high school athletics, we see a lot of ligamentous injuries. And now anything that improves performance, turf, cleats, any current turf at the high school, accelerates the play, accelerates the level of play, but also increases the frequency of injuries. So a typical bad ligamentous injury would involve the anterior cruciate ligament. And we're seeing certainly there are 100,000 ACLs per year nationally, and I think that number is slowly ticking up based on our small biopsy here in the UP, and as well as the national conferences learning about that.
So for lay people like me and many in our audience, you're not always dealing with the knee itself, but the
internal ligaments of the knee. There's two structures in particular with high school athletics or college athletics that are injured. The ligamentous anatomy, which is usually the ACL, 70% of the time, and sometimes what's called the meniscus, or some lay people like to call it the cartilage. The meniscus is really a pad between the thigh bone and the shin bone, which is vulnerable to injury with flexion and twisting injuries. Soccer, football.
What about those who just get old like me and can't blame football?
The two are related. So high school injuries that damage that shock absorber I'm talking about, right. If you no longer have a full complement of that shock absorber, then you're set up for what we call post-traumatic arthritis, which means arthritis after an injury. So we're seeing wear and tear arthritis, or old person's arthritis, at a younger and younger age due to a more active population that has experienced orthopedic injuries earlier in their years.
Now, arthroscopic surgery has become very important, or is that what many of your cases would be? A less invasive procedure?
Arthroscopic is a procedure done through the scope. So anytime you see scopic, it can be endoscopic, which is through the vasculature, or laparoscopic, which is through the abdomen. In orthopedics, arthro is joint, so arthroscopy is scoping of a joint. And like I said, operations are evolving quickly, and what we can do now through the scope has significantly been advanced in the past 10 years, both in terms of our technical abilities as well as the instrumentation.
Now, you also do knee replacement surgery?
Correct.
When would that be necessary?
Well, truly, and that's a question I'm asked 20 times a day in the clinic, the timing for joint replacement surgery. And I truly think for an excellent outcome for a knee replacement surgery, it's really not dependent upon age, and it's not necessarily dependent upon the x-rays. I'm fond of saying I treat patients, not x-rays. Having said that, I think the criteria is failure of conservative measures, meaning there are many things non-operatively that we can do. Because you're seeing the orthopedic surgeon in the office does not necessarily mean you're going to have orthopedic surgery. It means the surgeon's kind of dictating your care. But a good surgeon will find some conservative means to take care of the knee until the quality of life is compromised. So a good outcome for a knee replacement requires failure of non-operative measures, compromise in the quality of life, and again, radiographs that demonstrate advanced arthritis. With that scenario, I think that's the perfect recipe for an excellent outcome after a knee replacement.
What about people out there now who have chronic knee pain? You know, when should they seek treatment? And you know, do we make the problem worse by putting it off sometimes?
Well, yes and no to the putting it off. If there is a meniscus we've referred to already, if that's out of place, that's a structure that actually can cause damage to the joint surface. If it's not perfectly lined up in the joint, it can almost be like a Coke bottle cap inside of the knee that's grinding the cartilage down, and that's creating permanent change on the slippery articular surface on the joint, which predisposes you to arthritis. So, yeah, I mean, if you have an injury where the knee is catching and locking, there's something wrong in that situation that should be addressed. So it's best not at that point to employ your sisu and work through it. You're actually doing some destructive, permanent damage.
You mentioned surgery is not always the answer, and back to your group. Your group, I think, includes about 20 doctors and other providers, some specialists in other areas other than surgery.
Oh, correct. Yes, we have some non-operative sports medicine people in our office. We have podiatrists. Some do surgery, some do not do surgery. We have a slew of physical therapists. Yes, we're blessed with a plethora of orthopedic care in our office, and all very good subspecialized care.
Is your objective of your group to allow people to receive these services close to home here in Upper Michigan?
Well, absolutely. Not only close to home. I mean, convenience is one thing, but quality of care is another. And I'm very proud to say that there is anybody in our office I would have my spouse or my family come in and take care of, and I have access to any orthopedic surgeon in the country. My wife was actually in the clinic today seeing our foot specialist, and I'm very proud of who we have in there representing orthopedics. We worked very hard, we being the old tenure in our group,
right.
Worked very hard, and actually it took a fair amount of financial energy as well. But I'm very proud to have, if anything, that be my legacy in Marquette, is to leave behind a very functional, orthopedically functional and personally functional office. It's one thing to get 12 orthopods assembled under one roof, but to have 12 personalities that are that dominant that all get together and interface professionally well and personally well is pretty unique.
Okay. We'll follow up on that in just a couple of minutes. Back with more on the Ryan Report after we take one more break. Once again, our guest this morning is Dr. Wally Pearson, orthopedic surgeon from Marquette. A little more about your group. Now, you're associated with UP Health System Marquette. What's the arrangement there?
We're a completely private group.
Okay.
However, we interface on a couple different levels. My personal interaction is primarily through something called Marquee, which is the Michigan Joint Initiative. And they've supported me, and I've supported them on that venture, which has given us state and national recognition for what we're doing up here. And they have been supportive of me doing that, and vice versa. There's not many things that I've requested of them related to that service specifically that they've not responded to. Having said that, we're a private entity, and I use their operating room suites, and that's really about where it begins and ends.
And you and UP Health System and UP Rehab are joining together to be part of a new facility in Marquette?
Correct. I was going to transition to that also.
Tell us about that.
That's a perfect example of how healthcare is better with multiple interests. So we are a private group. A local contractor is trying to develop a bit of a legacy project, and nominated, I think through his friendships, physical therapy is a need, and sports medicine in particular. So there's a project where we're building a sports medicine complex that's going to involve not only UP Health Systems Marquette, as well as our private office, as well as some local physical therapy, but even Northern Michigan University is going to have some aspect of involvement with it. So it's a multi-group participation that I think is really going to not pay dividends. I hate to use the word pay, that implies financial benefit, but it's really going to benefit the patient at many different levels. But the collaborative effort of all these institutes working together to achieve better health care can only be a home run.
And this will be built on Washington Street, and in fact is being built kind of near where the new hospital is being built.
Conveniently, yes. I think the person that I referred to with the Legacy Project identified that he had some land in a situation that was juxtaposed to this beautiful new hospital. Probably best not to put something other than healthcare in that situation. So it's going to be in the front door of the hospital, although it's a relatively private entity.
Will your offices be there too, or?
No, we're maintaining our presence in the medical center.
Okay.
But as we grow, we need more space, and this is a perfect outlet for us to have a satellite sports medicine clinic that will rotate through. And I just signed some papers right before I came here for imaging equipment. We have to take out a loan to get some imaging equipment in there. So we'll have full-service sports medicine right in that center, juxtaposed to the new hospital.
And again, your objective is to have these services available here in the UP for people who need them.
Not only, again, not only convenience, but quality. And us building a satellite office there does not make us any more money. We're not going to be reimbursed more because we have X-ray there and in our office. It's for convenience for the patient to provide quality care locally. Yes.
Let's talk a little more about your firm in the sense that I know you're very involved in the community, and particularly helping out with sports programs and football programs, for example, in the area. Several of your doctors are serving as team physicians, and these are pretty much volunteer services?
They are, and I think the real benefit of being in a community this size is the privilege of being involved with people's health care, and to be able to get to football games, the high school football games, the college games, the NMU hockey games. It's really fun to see the action, but also be involved with the health care of the players and kind of know the story behind the patient that just scored a goal from the blue line, what they've been through to get back on the ice, and the mental and physical commitments they've had to employ to get to where they are.
And I know some of your doctors are involved with things like the Ore to Shore and the Nickaymonon ski race.
There's really not an athletic event that happens in this area that sports medicine or orthopedics is not involved with, and primary care as well. So a lot of the family practice people are helping cover a lot of the events, but they're well covered. We're fortunate to have those services. But from the opposite end, as a healthcare provider, we're blessed by being able to do that. That's really a privilege.
And the other thing is, you really enjoy the lifestyle here, don't you? You're a kind of a Youper through and through when it comes to the outdoor lifestyle.
More importantly, my troll wife, who's not from the UP, thoroughly enjoys the area. So I had a wonderful job in upstate New York at the university that trained me, which is the ultimate compliment. And when we had our first child, I realized the thing I felt most fortunate about was being raised in this area. We threw away the university contract and moved back 21 years ago, and I've not regretted that for a moment.
Well, and it's been great to have you here. You've made a big contribution to orthopedic care in Marquette County and the UP.
Thank you. It's my pleasure.
Thanks for coming in this morning. Appreciate it very much.
My pleasure.
Okay.
Thank you.
I'll be back with more on the Ryan Report after we take one more break. You know, it's hard to believe that the day may not be that far away when we say goodbye to the telephone. No, I don't mean that thing you carry around in your pocket, which is really a computer and a camera that also makes phone calls. I'm talking about the one that started out with the handset that sat in a cradle that you picked up and put to your ear to make conversation. I should tell you this is not based on any official reports, just my opinion. But I don't think it's far off. Today almost everyone wants to carry a cell phone, and a lot of those people have decided they don't need both a cell phone and a so-called landline. If one must go, it's not going to be the cell phone. I don't know how it is in your house, but in mine, the phone we've had for years has become mainly a very large annoyance. By far, the vast majority of the calls that arrive on that phone are calls we don't want in the first place. They're junk calls, someone trying to sell us something or trying to carry out some scam. It helps if you have caller ID, but even that's been compromised since the scammers now have the ability to make it appear to be a local number, even when it's not. What has happened to the telephone is kind of sad. I've been around long enough to watch much of the evolution of Alexander Graham Bell's wonderful invention. No, I wasn't there in the beginning. I'm not that old. But I can remember when you picked up the phone and a pleasant voice said, "Number, please." Those were the days when you actually talked with a person known as the telephone operator. And it was a real person, not one of those robots we talk with today. Then we got to see the dial telephones arrive. What a revolutionary development. I'm sure a lot of you have memories of those days when the telephone exchanges had names in front of the number. Like here in Marquette County, it's Canal 6, Granite 5, Hudson 6, and more. And of course, those were also the days of the rotary dial phones, and a lot of young people see one of those today and wonder what they are. Over the years, that old-style telephone was pretty special, and so we've come a long way from the days when Dick Tracy had a wrist radio and only doctors and really important people had mobile or car telephones. Now a lot of elementary-age school kids spend part of their day staring at that small screen. Oh well, that's progress. After all, we do have that phone we carry around in our pocket. I guess the biggest problem today is, what will Superman do? That is, what will Clark Kent do when he needs to change into Superman's outfit? I mean, have you seen a telephone booth lately? I'll be back in a minute. It's about time to wrap it up for another week. The Today Show is just about set to roll. There is enough time for me to remind you that you can find the latest news anytime at uppermichigansource.com. You can also find a rebroadcast of this show at that same location. Thanks to Dr. Wally Pearson for joining us this morning to help us learn more about the orthopedic services that are available to help people today. And thank you for joining us. I hope you have a great day.